So Nicole Bottino, she's a pediatric orthopedic physician's assistant, is going to come up and talk to us about a really important topic, and it sort of falls under the overuse umbrella as well. She trained at Boston Children's under kind of the godfather of pediatric sports medicine, Dr. Lyle McKaylee, and they've done a lot of research together to support some of these recommendations that are going to be made.
Thanks so much to Dr. Jaffe and Dr. Friedman for the perfect segue into my talk today. So we know that youth sports injuries are on the rise in the United States. The injuries are occurring during important years of child development, and the consequences can be lifelong. Many of these injuries are preventable, so I'm here to talk to you about what we can do to prevent the injuries, how we can get the word out about it, and how all of you as pediatricians and people who interact with these patients can help. So we know that obesity is a huge problem in the United States. 1 in 5 kids are obese, and this is something that we see in our clinical practice every day. So we push kids to be active in sports as a way to combat this. We know that youth sports promote exercise, teamwork, leadership, a way for them to socialize with their peers, self-esteem, and just kids having fun. So in a country where we're fighting obesity and promoting exercise, the question becomes, how much is too much? So let's start off by talking about some stats. There are 30 million kids in the United States who participate in youth sports. 2 million high school athletes sustain sports-related injuries in a year. 500,000 doctor's visits come out of that, and 30,000 hospitalizations. 3.5 million children under the age of 14 have to receive medical treatment for a sports-related injury each year. Nearly half of the injuries that we see are related to overuse. 62% of these injuries occur during practice. However, 1/3 of parents don't have their children take the same safety precautions at practice as they would during a game. And probably the most important of all of these statistics, more than half of the sports injuries that we see in children are preventable. So we're going to go through a little bit of a timeline to know where all of the spark about this started. In the early 90s, we started to see a trend of kids specializing in sports at an earlier age, and because of that, they're spending a lot more time per week competing in and training for that sport. So in 2015, many of the research-based pediatric sports medicine institutions in the US started to ask the question, does early specialization contribute to the rise of sports injuries that we're seeing? And in 2016, the American Orthopedic Society for Sports Medicine released a consensus statement that brought that question to light. So in 2019, there was a landmark study that was released by Boston Children's Hospital that ended up stating that early sports specialization, increased volume of participation, and inadequate rest dramatically increased the risk of youth sports injuries. And from that, 3 recommendations were made. 1, limit volume of participation. 2, delay sport specialization. And 3, let's make sure these kids are getting enough sleep. So based on volume, we know that a child should not participate in competitive sports more hours per week than their age and years, up to 16 hours a week. And based on the study by Boston, we know that if kids actually participate 3 hours less than their age, their chance of sustaining an injury decreases 3 times. Periods of rest are important for recovery, and Dr. Jaffe touched on this a little bit in his talk. A child should take at least 2 days off from competitive sports each week. They should only participate in 1 competitive team at a time in any given season, and there should be time away from organized sport at the end of each competitive season, and the average is about 3 weeks that's recommended. Sport specialization is defined as choosing one sport, quitting all other sports to focus on that sport, and then training in that sport 8 months out of the year or more. Introducing kids to multiple sports at an early age allows them to develop a diverse set of motor skills rather than only developing the skills needed for one specific sport. And early specialization decreases the amount of free and unrestricted play that kids have, and we know that during that time when they're playing freely on their own, they're developing injury protective motor skills. So these are things like kickball, playing on a playground, and playing tag with their friends. These are things that should really be encouraged. If a child wants to specialize in a specific sport, the safest age to do that is late adolescence or once they hit high school. So specializing in one sport also increases the risk of burnout and overtraining, and we know that burnout and overtraining increase the risk of sustaining a sports-related injury. Parents should be aware of the early signs of burnout. There are both physical and emotional manifestations of this. Physical, you'll see that their speeds while they're playing are slowing down. They're not able to execute certain sport-specific skills like they were before. They are not achieving the goals that they once were able to achieve in their training, and they're getting tired more easily. The emotional signs, these tend to spill over both in sport and at home or in school. So one is a lack of motivation both at school and with their sports. They become more irritable, and they're unwilling to cooperate with teammates and parents, and I think some parents may just call this high school. So sleep, their adequate rest is very important for adequate recovery. The CDC reports that 6 out of 10 middle schoolers don't get enough sleep, 7 out of 10 high schoolers don't get enough sleep. The recommendations for children 3 to 5 years of age are 10 to 13 hours in a 24-hour period. Children 6 to 12 years of age should sleep 9 to 12 hours. And then as we get towards high school, those recommendations start to shift to that of adulthood at about 8 to 10 hours. We know that high school athletes who sleep 6 hours or less are at a much higher risk of sustaining a fatigue-related injury the following day. And high school athletes who sleep less than 8 hours are 1.7 times more likely to sustain an injury than their counterparts who sleep 8 to 10 hours. So rest and relaxation are ways to promote restful sleep and recovery. Specifically, what they recommend for this are yoga, mindfulness, and meditation. There are a lot of yoga studios that are offering classes specifically geared towards children. And there are apps that are geared towards kids now for mindfulness and meditation. These are two of the more popular apps. They both focus on age-appropriate, basically like bedtime stories for younger kids and guided meditation for older kids. Headspace is really the most common one, and when you do out the annual fee, it comes to close to $6 a month. And Smiling Mind is also very good, and that one's free. So we're often asked what the highest risk sports are. And we know that football has the highest rate of traumatic injuries. Soccer and gymnastics also have high rates of traumatic and overuse injuries. But this is a really tough question to answer because we know that with these recommendations, if they're not followed at enough of a volume and enough of an early specialization, any of these sports can become a lethal weapon, and this is something that we see in our practice daily. So why do so many parents and kids choose to specialize in a sport at an earlier age? This is something that Dr. Freeman touched on a little bit before, which is parents want their kids to be an elite level athlete. Kids want that as well. They want scholarships, and they want to be like their professional athlete role models. The fact of the matter is, many of their professional athlete role models were actually multi-sport athletes. We know that Tom Brady participated in baseball and football through high school, and he was almost drafted to play baseball professionally. And combined, the United States women's national soccer team competed in 14 different sports in high school. So, to put things in a little bit of perspective for the parents, only 1% of high school athletes receive sports scholarships. 3 to 11% of school athletes go on to compete at the college level. 0.03 to 0.5% of high school athletes go on to reach the professional level. And as many as 70% of children drop out of sports by the age of 13. And the reason behind this is thought to be coaches and parents. So to go through a little bit of a case, what do we do when we have a challenging patient, or more realistically, a challenging parent? So an 11-year-old male presents to your office with a complaint of bilateral heel pain, which has been present for a year. The pain began with running, but now occurs with walking, and has been getting progressively worse. He's active in soccer about 18 hours a week, participates on 2 different teams, and plays about 11 months out of the year. On average, he takes about 1 day off a week, but there have definitely been weeks where he plays 7 days straight. So he comes into you and he's wearing his jersey, his matching shorts, his socks, and it's 1 o'clock in the afternoon on a Tuesday, so you know he definitely went to school dressed like that. And so you kind of pan to the other side of the room and you see Dad, and you're hoping for a voice of reason, but you see Dad wearing a matching jersey, shorts, and he has a jacket on that says Coach. So after talking to him for a little while, you have a pretty good idea of what his coaching technique is. And I like to call that a poor prognostic indicator of how the rest of the visit's about to go. So you go on to recommend rest from sports, physical therapy, and anti-inflammatories. To be met with this is the response: rest is not an option because it's going to crush his Olympic dreams. Now, this is an actual quote that Dr. Davis and I received from a patient that we saw in the office together. And just diving into that a little bit more, we know that some parents are a little bit intense, because this is another actual quote. However, this one is from Dr. Davis to her son at his soccer game, and he's only 5 years old. So, yeah, no, I'm really not kidding. So, but it's okay, I talked to her about it, we went over this presentation, and I think she's on board with making some changes going forward. So that leads to the next part. So the most important thing I can send to all of you today is that we really need to educate the parents on how important this is. We know that pediatricians are really the first line of defense. Pediatricians have the most consistent contact with our patients and their parents from a very early age. So you're the ones who can really fire this home. And data released by the American Orthopedic Society for Sports Medicine shows that 80% of parents are unaware that these recommendations even exist. So what resources do we have? There's resources available to us as healthcare providers and also to our patients and their parents. One of the best ones, I think, is STOP. It's an organization put together by the American Orthopedic Society for Sports Medicine, and its sole purpose is to prevent sports injuries. If you go to their website, they have a lot of good resources for our patients and their parents, like blogs, newsletters, and injury prevention tips. And for healthcare providers, they also have research articles, patient handouts, and informational posters that you can hang in your office. Another good one is Safe Kids Worldwide. It's a nonprofit organization that was founded in 1988, and their sole purpose is to keep kids safe. They started off with making recommendations about things like wearing your helmet when riding a bike and checking for car seat safety. And now, since sports injuries are on such a rise, they created an entire section called Sports Safety 101, where they have really great short informational videos geared to our patients that basically outline exactly what I just said. I also provided a handout in each of your folders today. This is just a quick reference sheet for you, and it outlines the hot points of this talk. It's something you can hang in your office or you can give to your patients, and if you want more copies as a way to hand this out to your patients, we're happy to get those to you. So in summary, youth sports injuries are on the rise. Limiting volume of participation is key. Encouraging participation in a variety of sports and delaying specialization is really important to help keep kids safe. Patients and parents need to be educated on these recommendations, and pediatricians are the first line of defense. Thank you.